something to the students. So it is only a beginning class for me through this audio. Okay. So particularly in that first we start with the aphorisms. Various topics are there. Okay. So let us see how it is going on. So first I start with the case taking, because you already know about that in first year the portion is restricted up to 28th aphorism. From the second year onwards you have full aphorisms. That is second year up to 104. Then third year and final year 104 to 105 from drug proving to till end. Okay. So case taking is a very vital important theory as well as a practical, particularly the practical, because in all other subjects, I am not criticizing any other subject, but in all the other subjects, no problem, that evidence is there, because their subjects are belong to science. But here when you come to our subjects, that are organon and philosophy, homeopathic philosophy is an art. Because just you see, some you belong to many religions, I think so. When you heard about this voice, you may belong to Hindu, you may belong to Christian, you may belong to Muslims. Particularly in most of the religions, mostly they have one religious book. Particularly when they go to church, they have the Bible in their hand. Do you think they forget Bible? There is a words of Bible in every time, so only they want to refer? No. It is the duty of the Christian to have the Bible. It is the duty of the Muslims, okay, have that Quran. Like that it is duty of the Hindus, Bhagavad Gita. Like that. It is the duty of a doctor, particularly a homeopathic doctor, must have the organon book. Because just we compare this book in all the religious book, it is an art. So whenever we go to the religious, whenever we go to philosophy, it is a debatable. Always a problem is there, it is a debatable. Okay. Because when I say something, next day they told, oh no, you are wrong, like that one. Okay. So we just forget that one. So our book is organon. Mostly I start to teach from the 6th edition of organon. It is the latest edition. There is no confusion. This edition was also written by Hahnemann, even though released by somebody else, because you already know about that posthumous edition. This was purely written by Dr. Hahnemann. Okay. So only that main difference is 1 to 291 aphorism in 6th edition of organon. So the case taking, you already know about the case taking starts from the 83 to 104. But here also some confusion is there. It may be start from the 82 aphorism itself, because you already know about that from the 70, there is a 70 conclusion. There is a 71 is the starting of the practical part. Then when you come to the 72 aphorism, start about the classification of the disease. Then from the 72 to 82, the classification of disease are there. But you already know about that each aphorism is linked one to another. Okay, there is no doubt in it. The linking is there. So when you see that 82, Hahnemann, this is the last aphorism when he discussed about the classification of disease. Because when you go to the classification of the disease, he finally touches that Sora, psychosis, and syphilis. And also you just to describe that about that antisoric remedy you prescribe for the antisoric remedy 1881. Okay. So now you discover the specific homeopathic remedy for the psoriatic condition, but it is not very easy to prescribe the medicine for the psoriatic condition. Okay. So here only Hahnemann made the difference between the acute case taking and the chronic case taking in 82 aphorism. So my dear students, okay, actually it is not for any intelligent student, because you already know about that one. I am only taking the class for the weak students. Just to keep in mind, I am only taking the class for the below average, not for the above average. All are having the equal knowledge. There is no doubt in it. but some students. Okay. So, when you take that 82 aphorism, Hanuman mentioned that. That is individualization, Hanuman mentioned that particular aphorism, 82. Okay. So, from the individualization only, we just select the medicine. From the individualization only, we select the character symptoms of the patient, of the particular patient. So, from that 82 aphorism, Hanuman mentioned about the difference between the acute case taking and the chronic case taking. So, dear students, whenever you want to hear that topic, just you take your Organon book, especially 6th edition of Organon, because without the book, take it for granted, it may be a positive or negative thing. Without the Organon book, I won't enter into the class. These things were maintained by me for the past 20 years. Okay, because whenever you want to teach anything which is a philosophical, and when that philosophy was written by somebody, you should take the book. So only when you go to the church on Sunday, okay, that priest is there. So many persons are, even the Pope, they also have that Bible in their hand. Like that, you just think our Organon book is nothing but a Bible for us, nothing the Quran for us, nothing Bhagavad Gita for us, whoever it may be Jain. Okay, so just to take that book, because I am not teaching anything new, because you already taught by it your esteemed professor of that Organon. Your professor already taught. Okay, so just repeat. So here, when you see in that acute disease, it is last by 6th line of that particular 82 aphorism. The chief symptoms strike us and become evident to the senses more quickly. Because the acute disease, you already know, the sudden onset. Okay, that patient is having the fever since yesterday. High fever is there. He developed the dryness of the mouth, and also he want to take the water in the large quantity. Okay, he is not able to sleep by that fever. So, the still freshen in the memory. When the patient, just when you go to the doctor the next day, when you want to meet the doctor next day, he won't forget that. When you have the diarrhea, when it is acute condition and you pass the diarrhea and the 10 or 15 times, you won't forget that. The color of the diarrhea, how you feel the pain, like that. Okay, so here all the symptoms are self-evident and to senses more quickly, and hence much less time is requisite for tracing the picture of the disease, and much fewer questions are required to be asked. Okay, because already the patient is suffering, so you need not ask anything. He just explained that symptoms spontaneously to the physician. Okay, so here, as almost everything is self-evident than in a chronic disease, because just to keep in mind, in acute disease classification, you need not strain so much. Particularly when you see the case-taking performer of acute disease and chronic disease. Okay, acute disease performer is 2 pages, but the chronic performer is 3 pages. Why there is a difference? According to Hanuman, whether it is acute case taking or chronic case taking, he didn't bother about that. Only want to prescribe the medicine based upon the uncommon peculiar symptoms. That is a character symptoms. Clear? So, acute disease self-evident. What about the chronic disease? In chronic disease, which has been gradually progressing for several years, in which the symptoms are much more difficult to be ascertained. Okay, because it is a long term. So usually, I just compare that acute disease and chronic disease with our friendship. One person is always along with us. Another person is always the enemy to you. You know your enemy whenever he want to meet you. You are very much cautious regarding your enemy. But if it's that person, or if you have one of your best friend, because in this world it is not possible to believe anybody that is there. Okay, don't believe except your parents, that's all. So your close friend is there, your close lover is there, because in this age it is a common one. So when you have that person, when that person turn their arms against you one day. Okay, because you just believe that person and sharing all the thing to the person. But now that person, due to some reason, he just turn back. Because he always, that person is with you only. You don't know how much he digging that or borrow that for you. Okay. So in chronic disease, it is a long duration. So only Hahnemann mentioned that in chronic, which has been gradually progressing for several years, in which the symptoms are much more difficult to be ascertained. So in acute disease, no problem at all in the case taking, but in chronic disease, it is a problematic. Okay. So 83. This individualizing examination of a case of the disease. What is this? Because you already know about that, even though that aphorisms are separated, each aphorism is interlinked with any other one. So this individualizing examination of the case of the disease, for which I shall only give in this place general directions. Okay. This individualizing examination of the case of the disease, for which I shall only give in this place general direction. Now we just start to about the proper case taking, particularly chronic case taking. Because each and every disease condition or each and every patient is different one to another. One patient is having the menstrual pain and another is having the headache. One patient is suffering with the diabetes symptoms for a long time. It is not possible to see all the persons in the same eye. Okay. So Hahnemann has given only general direction, general idea regarding the case taking. So these are the general idea. Then just you ask the specific questions regarding that one, of which the practitioner will bear in mind only what is applicable for each individual case. Okay. So Hahnemann has given only general direction, and it is duty of the physician which one is applied for that one. Demands of the physician, nothing but the freedom from prejudice. This is a very important aphorism. 83. Qualification of the physician for case taking. Many students are confusing that the qualification of the physician with that 83 aphorism with that third aphorism. Third aphorism, there is a general aphorism, it deals about the knowledge of the physician who treats judicially and rationally. Okay. But here is just especially to the case taking. So demands of the physician, nothing but freedom from prejudice. This is the first point. You already know about the sixth aphorism, unprejudiced observer. So like that, when the physician start to take the case, first freedom from prejudice. You should not have any pre-opinion regarding that case. Because when you see that sixth aphorism footnote, Hahnemann mentioned that. Okay, without seeing the patient, we won't do anything. We won't say anything. Because yesterday just you saw a fever patient. Today just you are seeing a fever patient. Okay, so don't compare these two things. Oh, yesterday I already saw that patient, so why you waste the time like that? You don't say like that. In allopathy, okay. Okay, in allopathy it is okay. Whoever it may be, when they are having the fever, commonly, mostly they just prescribe any paracetamol for that one in combination. Okay, because paracetamol, whoever it may be, A to Z, when you have the fever, it reduces the temperature, but it is not like that one in homeopathy. So freedom from prejudice and sound senses. What is the meaning of sound senses? You already know about that. Hahnemann used the word senses. Hahnemann own aphorism particularly mentioned in one senses cleverly. Were you able to recollect that one? Ninth aphorism, last line. Then reason gifted mind can freely employ this living healthy instrument for the higher purposes of our existence. Reason gifted mind. Which sense? Sixth sense. Reason gifted mind. Because up to fifth senses that animals are having, they are not having the reason gifted. They're not thinking about themselves. So Hanuman mentioned that reason, gifted mind. Just see the word gifted. It is only gift given by the God. Reason, gifted mind. So here, just the physician use all the senses. Must be sound. Okay, because just we can see the patient. Eyes. Just to use the constitution of the patient, especially when the physical constitution is there, like that of phosphorus or like that of calcareous. Okay, and when you examine the stethoscope in the patient chest, just you heard about that one. Okay, that is when you see the spongia. What mentioned the spongia? In the spongia, they mentioned that like a saw driven through a pine board. Okay, just you hear that one. So here we use the ear senses. Then next, the smell of the cadaverous odor is there. In one place, just Hanuman put the rotten eggs. There is a spoiled eggs. And another place, he just mentioned that cadaverous smell. That smell must be there. Where you come the taste? Whether we taste the patient? No. But why Hanuman mentioned that? I don't know. But when you see that caladium, on medicine is there, caladium. Just when you refer that caladium, on symptom is there. Sweet sweat attracts the flies. How you know that sweat is the sweet? Because the flies attracts by many things. Okay, I may mention that flies, not the bees, flies. Then how you mentioned that sweet sweat? So the physician used all the senses. So only Hanuman sound senses. Attention in observing and fidelity in tracing the picture of the disease. Okay, there is another important, observing and fidelity means faithfulness. Okay, the physician, when he record the case, the faithfulness must be there. He must be genuine. Okay, so here, first point, freedom from prejudice. Second point, the physician must have the sound senses. Third point, attention in observing and fidelity in tracing the picture of the disease. So 3 points are there. So 83 aphorism, starting with the case taking. Then 84, the patient details the history of suffering. See, when you particularly note that how Hanuman used the word. So only the present day history, you should not use any medical term or any abbreviation. Because you just, what you do, you just write out the history. The patient details the history of his sufferings. You just get the details, the story. Those, how you get the symptoms. What are the ways in which you get the symptoms? Those about him tell what they had him complain of. Particularly that those surrounding people, that is attenders. Okay, then how he has behaved and what they have noticed in him. So first he gives the important to whom? The attenders. How he has behaved. Whether he behaved normal or abnormal when compared with the normal condition. Then what they have noticed in him. Because sometimes the patient may be the colosynth patient. That patient doesn't know how it relieves, but he just bending double. Okay, the colosynth. So the physician so when you ask that patient, the patient at the time he may forget that one. But the attendant who is nearing, that person know about that one. Okay, so bending double. So that is what they have noticed in him. The physician sees, hears and remarks by his other senses. So last aphorism I told, senses. So here, hears and remarks by his other senses what there is of an altered or unusual character about him. Okay, it is very hard to find out, but just when you see any unusual character is there. For example, it is the winter season, it is the summer season. The patient is coming to you in the summer season. Just imagine, it is imagine. But at the time, we just what is called, you cover the whole body, even in the summer. Okay, many texts are there. It is an unusual one because in all the patients who are having that fever, no, it's not possible to that. Okay, so this patient, just you see the what are the abnormal you find out the patient and compare with the normal. That's all. Then he writes down accurately all that the patient and his friends have told him in the very expressions used by them. Okay, this is the instruction for the physician. He write down accurately all that the patient and his friends have told him. Write down accurately. Don't miss any symptom. Okay, just it is mentioned by physician as well as mentioned by attenders. In the very expression used by them. That is a very important word, very expression. Exactly what he feels. When he feels the burning pain, how is the pain is there? Sir, it is not possible to tolerate the pain. You just wrote like that on that patient, not able to tolerate that pain. Don't simply write burning pain. Don't simply write pain. Okay? Because now the patient, very expression used to be there. The next one is the keeping silence himself. Who? Doctor, physician must keeping silence himself. He allows them to say all they have to say. See, super, no? How Hahnemann mentioned that one. He allows them to say, that is, the physician should allow the patient to say, the patient only say all they have to say and refrains from interrupting them. What does mean refrain means? It is just nothing but an avoiding. Refrains from interrupting them unless they wander off to other matters. Okay, unless they wander off. For example, just allow the patient to talk freely. The physician advises them at the beginning of the examination to speak slowly in order that he may take down in writing the important parts of what the speakers say. He Hahnemann used the word speaker. Note it, what the speakers say. Okay, so at the beginning of itself, just you give the instruction to the patient, speak slowly. So just you write down all these things. So here one footnote is there, and refrains from interrupting. The footnote is there. Every interruption breaks the train of thought of the narrators. One time he just put that speaker. Here he put the narrator. Okay. And they would have said that first does not again occur to them in the precisely the same manner after that. It is just Hahnemann mentioned that why we not interrupt when the patient is explained that symptoms. Okay. What is the meaning of the interruption? What happened? See, particularly in all the subjects, they just teaching. Okay. Teach them in the flowing. When the master explain anything to students, that is your teacher, or when you want to explain anything very seriously to your friends, at the time any interruption comes, what happened? Just your mind is distracted. Then when you start from the last session, what you was closed. Okay, now you start again, but it is not same as it is before thing. Okay, it is not same as it is before thing. So what you do, don't interrupt unnecessarily. Okay, clear? So 83 is clear.